Hi, this is Dr. John Carollo, and today is Wednesday, May 13th, and this is my second patient communication video from our office during the COVID-19 pandemic. Again, I hope you and your family and loved ones are healthy and practicing the recommended COVID-19 guidelines for social distancing and staying safe. A lot has changed since the last video that I did on April 14th. We are starting to see the curve of new cases and deaths flattening in New Jersey and other areas in our country. But the pandemic is not over, as we all know. Some states and essential businesses are opening up. My last full day of seeing patients in our office was Monday, March 16th, and since then, we've only been effectively seeing essential patient dental emergencies and some very selective dental sleep patients for the past 10 weeks. The first 6 weeks that we were closed, there were very few patient emergencies that I had to treat. But what I've seen over the last 2 weeks is our office has seen an increase in the patients needing essential dental care. This is to be expected since we've been closed for 7 to 8 weeks now. Patients have been calling our office and asking when we'll be open or reopen for dentistry and essential dental sleep medicine care. Well, this past Friday, May 8th, the New Jersey American Dental Association spoke directly with Governor Murphy's office regarding this issue. This is what was being told from the governor's office, and I quote, "The governor never intended to prevent patients from receiving necessary dental treatment. The only requirement the administration issued was a suspension of the performance of elective treatment or invasive procedures that can be reasonably delayed." It also stated that the treatment dentist or the treating dentist use proper discretion and not delay treatment that may risk the future health of a patient. So this is actually found at www.njda.org. So if you or a family member have a dental or dental sleep related issue, please contact our office directly and speak with a staff member or myself to see if your treatment is needed at this time and when you should make an appointment. We are also going through the next 3 weeks of already scheduled patients starting with Monday, May 18th, and we'll be contacting you to confirm your upcoming appointment or reschedule this appointment based on my recommendations for treatment and or your comfort level for coming in at this time. Additionally, as I mentioned last time, we can do a telemedicine or teledentistry virtual appointment first. Again, this is a platform where I can set up a video conference with you, which is HIPAA compliant to go over any necessary treatment. So feel free to call the office at 973-377-5117 and request this if needed. And again, I will be able to go over your dental or dental sleep medicine concerns. So now you can see on the left, this is our telemedicine setup where I have a headset on and I can talk to you live. And on the right, you can see our new personal protection equipment, gown, gloves, face shield, mask. So we're going to really implement this in for all dental visits in post COVID-19. So here you have Megan, one of our dental assistants, with her face shield, eye protective eyewear, mask, gown, gloves, and booties on at our autoclave. The autoclave is a heat steam sterilizer that we utilize for all our dental instruments, which are bagged and never opened up until you come into the treatment room. Our autoclave is also tested weekly by Emory University for compliance that it's working properly. Please remember, we have always used the proper personal protection equipment, proper sterilization, and infection control for the past 35 years. Gloves, masks, eyewear, hand washing has always been done per CDC and American Dental Association guidelines. We also are disinfecting all environmental surfaces after every patient and using disposable items when indicated. And additionally, we have now added some new COVID-19 protocols. For instance, Patient screening will be done prior to any treatment. So we will have a questionnaire and talk to you about travel, contact with COVID virus in the past, fever, dry cough, etc. We're also going to have you call us from our parking lot prior to entering our office so that we can make sure we are ready for your appointment time. So this will help us keep social distancing guidelines in effect. When coming to our office with children, we're asking only one child who has the dental appointment to come to the office. So this will help limit again and keep social distancing guidelines in order. As always, I'm always looking at new technology and information and different products to keep you, my staff, and I safe during each patient visit. So after we disinfect and clean our treatment rooms, we have now added UVC sterilization lights in all areas of our office. These UVC sterilization lights are gaining usage during this COVID-19 by other industries like hotels, hospitals, and the airline industry. So we've implemented that too. This is the UVC light that we utilize after sterilization in the rooms. So after disinfectant, we put this on for half an hour in each room in between patients and also in the reception area. We know that the COVID-19 virus is spread as an aerosol. So I am looking at some extraoral suctioning systems. I'm always looking at different technology, and there's some new extraoral HEPA filter systems that are coming out soon, and I will be looking at those and getting those for the office. Additionally, we're researching some air purification systems which also might be available to filter room air with particle size that's actually smaller than the coronavirus. So this is the dental extraoral suction system to help reduce aerosols from dental procedures that I have ordered. In the meantime, we're going to be using some specialized funnel type of extraoral cups to help control aerosol during dental procedures. And as we mentioned before, we're doing a pre and post treatment rinse of 1% hydrogen peroxide that's recommended by the American Dental Association, taking temperatures and pulse oximetry as part of our routine assessment. So besides using PPE that we've always used, we've added gowns, shoe booties, and face shields in addition to our level 3 or KN95 masks. And lastly, I would like to thank my amazing staff for all that they have done during these past 11 weeks. I am truly blessed to have this team of dental health care professional providers who have come in to call patients, rearranged our office to be compliant with the COVID standards, and preparing for you, our patients, when we come back to a more normal schedule. Most of you have known our staff for years, but again, I'd like to thank Gina and Donna, Gisela, Megan, Margaret, Lily, and Victoria for being the amazing team that you are. I could never be as successful or be as compliant in everything I do without you as my team. Thank you again. So as always, thank you, our patients, for allowing me and my staff to be your dental practice and your dental sleep medicine office, especially now during the COVID-19 period. And rest assured, we will always do whatever is necessary to provide you and your family with the latest in dental care and dental sleep medicine care in a safe environment. Thank you, and I look forward to seeing you soon.